Hey guys, I'm Dr. Aaron MacArthur, and I'm the owner of Portland Chiropractic Neurology. I just wanted to explain a few things about what we're looking for. What we're looking for are doctors who are interested in a training program, residency format that really gets into the diagnostics and clinical aspects of chiropractic care. Um, I am a chiropractic neurologist, and I have a fellowship, two fellowships in vestibular rehab, and also in concussion and brain injury. But that's not a requirement if you're not interested in neurology. I have a broad practice that I personally treat a lot of musculoskeletal patients, but I also treat a lot of neurological patients too. So we have a really comprehensive style of treatment where we use chiropractic, physical therapy, neurology, and even hyperbaric oxygen therapy is something that I do in my practice for my neurological patients and lots of other things. But basically, we're teaching people how to evaluate, treat, and improve patients clinically. Your education in school is fantastic, and sometimes what we find is the transition into clinical work can be a little different, a little daunting. So residency, a little bit longer program to really train with me and other doctors that are skilled in your particular area, but mostly it will be with me probably in the beginning, where we really get you set and ready to go on and take those patients on, so you really do a good job. And there's really important things that we've created over 14 years of practice and a systematic approach that can really help you. It's not cookie cutter, but it at least gives you a really great format, and then we'll teach you all the nuances in between. And when you spend enough time with us, is kind of the goal of this, you'll really be able to treat and successfully treat most patients that come in. I'm right there with you, and then you start to see some of your own patients, and I'm still right there for you. So if you have any questions, I come in and help you. And so it really gives this kind of, letting the line out slowly type of thing where you can really get comfortable on your own, which is really cool. And then, of course, if it all works out, we'll turn you into a full-time, associate doc. And that's always good too. So it's a great opportunity. It's a passion of mine, I'm realizing, is to teach in this kind of specific area of clinical work in chiropractic and in functional neurology. And I will teach you aspects of that too that apply, but a lot of the applied neuroscience to our comprehensive care is, you're going to learn it anyway. So it's a pretty cool format, but don't think that you have to be a neuro geek to want to do this. This is not what this is. We have chiropractors that work with our team and chiropractic neurologists, so we both work super well together, and it's a really cool system. We also have a physical therapy practice upstairs that helps us and some of our patients, and we have occupational therapists that work with us and all kinds of fun stuff. So it's a fun team atmosphere, and it's something that I always enjoyed when I was in clinic, is working with a larger team and creating almost more of a hospital type format rather than the solo practitioner, which is great too. But I prefer more of the interaction and seeing different types of patients and helping each other figure things out, and training people, of course, to be the best doctors there can be, because in chiropractic, we really need skilled, great doctors out there, which is what your schools, of course, are doing for you. But I think I can help in some ways by bringing in some of the neurology and some of the other pieces of the things that I've learned along the way. We also pay for continuing education, and there are other benefits of working with us, student loans and those types of things initially, that in a residency format that can be helpful, especially when you're a new grad. So, one of the benefits is paying for your education, your student loans while you're in this residency program. And so once you become a full-time doc, then you'll be in a different situation where that will be on you. But we at our practice, we always pay for continuing education. up to $5,000 a year, because it's super important to me and to our patients, is that continued learning in whatever direction that is that you decide that's best for you and our patients. Cool. So if you have more questions, please reach out to me. I'll put my email on there. And I look forward to hearing from hopefully some prospective students. Hope you guys are doing great, and get out there and heal the world. Thanks a lot.